In this video, we'll discuss about adenoviruses. Adenoviruses are medium-sized, non-enveloped, double-stranded DNA containing viruses. All the viruses of Adenoviridae family have common complement fixing antigen. So they have complement fixing antigen. This adenovirus infect humans, animals and birds. So they have strict host specificity. So this one is medium sized non-enveloped double-stranded DNA virus have common complement fixing antigen infect human, animals and birds. So it is a host specificity. It have specific host specificity. Adenovirus infection is common in children worldwide, more common in asymptomatic infection. More common in asymptomatic infection. Symptomatic infection include the infection of respiratory tract and eyes. Rarely they can cause infection of intestine and urinary tract. So this one maximum most commonly asymptomatic infection. Symptomatic infection include respiratory tract and eyes. Rarely causes infection in intestine and urinary tract. The characteristic features of morphology of adenovirus, they are space vehicle shape. Space vehicle shape. So this is the morphology of adenovirus. Then growth and host range. Human adenovirus grow only in tissue culture of human origin. Tissue culture of human origin or human embryonic kidney cell, HeLa or HEP2. So it can grow only in tissue culture of human embryonic kidney cell, HeLa or HEP2. Next, cytopathic effect. Cytopathic effect are produced by adenovirus after several days. Characteristic cytopathic effect, they form grapes-like cluster. They occur cell rounding and aggregating, which gives grapes-like appearance. So this adenovirus after several days, they producing cytopathic effect. They form grapes-like cluster. Then classification adenovirus, the Adenoviridae family classified into two genera. One is masked adenovirus, second one is AV adenovirus. Masked adenovirus, this one is the adenovirus of mammals, this one for birds. Next, oncogenic human adenovirus, the serotype 12, 18 and 31, they produce sarcoma. So first disease, oncogenic human adenovirus, they producing sarcomas when injected into newborn hamsters. Adenovirus mainly causes infection in human that immunocompromised patient, mainly HIV patient. Group antigen presented in adenovirus detected by immunofluorescence technique or ELISA. Type specific antigen which are specific to serotype identified by neutralization test. Pathogenicity, adenovirus mainly causes infection of respiratory tract, eyes, urinary bladder and intestine. First one is pharyngitis. Adenovirus mainly causes of non-bacterial pharyngitis and tonsillitis. They presented as febrile common cold. Febrile means fever with a common cold. Next, pneumonia. Pneumonia produced by serotype 3 and 7. Pneumonia in children is similar to primary atypical pneumonia. In children and infants, they causes serious fatal pneumonia. That serotype 7, mainly the serotype 7 causes fatal pneumonia in children. Then acute respiratory disease. This is for the outbreak like military recur, caused by serotypes 4, 7 and 21. Then pharyngoconjunctival fever. This one caused by serotype 3, 7, 14. This one syndrome of febrile conjunctivitis and pharyngitis. Symptom of febrile conjunctivitis and pharyngitis. Then epidemic keratoconjunctivitis, more serious condition caused by serotype 8. So this one mainly caused by serotype 8 is more common. 19 and 37 also causes. Next, acute follicular conjunctivitis. Here it can occur the serotype 3, 4, 11. This one is non-purulent inflammation of conjunctiva with enlargement of submucous lymphoid follicles and free auricular lymph nodes. So acute follicular conjunctivitis, they can occur mainly serotype of 3, 4, 11, non-purulent inflammation of conjunctiva with enlargement of submucosa, lymphoid follicles and free auricular lymph nodes. Next one is diarrhea caused in children, the serotype 40, 41 of adenovirus. These serotype are called endemic type of adenoviruses. Serotype 40 and 41 causes diarrhea. Next, acute hemorrhagic cystitis. It mainly affected in children, serotype 11 and 21. So oncogenic human adenovirus causes sarcomas, serotype 12, 18, 31. Second one is pharyngitis. This one mainly caused by type 1 and 7. Then pneumonia, serotype 3 and 7. Acute respiratory disease, serotype 4, 7, 21. Then pharyngoconjunctival fever caused by serotype 3, 7 and 14. Then epidemic keratoconjunctivitis, serotype 8, 19, 37. Then acute follicular conjunctivitis, serotype 3, 4, 11. Then diarrhea caused by serotype 40, 41. Acute hemorrhagic cystitis caused by serotype 11 and 21. Next, laboratory diagnosis. First one is tissue culture method. Isolation of virus from throat, eyes, urine and feces. Then preliminary identification is performed by visualization of cytopathic effect, complement fixation test, subgrouping of heme agglutination and typing by neutralization test. So preliminary identification, what are the tests we are using? Cytopathic effect, complement fixation, subgrouping by heme agglutination, typing by neutralization test. Next, serodiagnosis. Here the rises in titer of antibodies are measured by diagnosis. Then electron microscopy used for that fecal virus isolation. Then immunofluorescence, viral antigen detection, we are using nasopharyngeal and ocular infection. Viral antigen detection, we are using immunofluorescence. Then PCR polymerase chain reaction based test used for detection of viral DNA. Prophylaxis, killed and live vaccines prevent only acute respiratory diseases. No vaccines available for general use. Thanks for watching.